Good morning, everyone. Welcome. Um, Unfortunately, Adam Shostak, a co-lead of the workshop, cannot make it today, so I have a pleasure of facilitating this conversation and workshop today. My name is Yuria Ito. I'm from CyberGreen. So today's session is particularly interesting for people. There's a lot of questions that it is hard to answer in a community, which is hard. Has the state of cybersecurity actually improved, declined, or stayed the same? It's a hard question without the proper measurement. In the cyber public health space, we also have these questions about intervention effectiveness, how we measure the intervention is effective and technically policy. And there's a lot of measurement, but today's speaker, Michael, is giving us his idea of looking at from the lens of end users harm. And that would be a very, very interesting talk. So let me introduce a little bit about Michael. Um, Professor Michael Hicks. Michael is a Cecilia Filter-Moore Professor at the University of Pennsylvania and director of the CyberGreen Center for Cybersecurity. Am I pronouncing right?
Blind Center.
Okay, Line Center. He has worked extensively at the intersections of programming language, measurement science, and practical security across academia and Amazon, AWS, and the large-scale university research centers. So with that, we are very excited to start, Michael. Thank you for joining us, and please take it away.
Thank you. I'm glad to be here. So today I'm going to speak about measuring cybersecurity through end user harm. Just to give a few more words and background and my motivation for the topic. Um, so I was a university professor at the University of Maryland for 20 years. I was at Amazon Web Services for 3.5, and I focused all my research efforts on uh, basically how to build systems better. How can we build systems that don't have vulnerabilities using novel programming languages or program analysis tools? How can we find bugs after we build them using things like fuzzing or property-based testing or static analysis? And it was always a given that doing so was a good idea, that you get rid of the vulnerabilities, you solve the security problem. But now that I'm back as a professor at Penn, I started a few months ago, I, I'm taking a different perspective, which is to ask the big picture question, is cybersecurity getting any better? Is all that stuff that we're doing making a difference, or is it just moving the pieces on the board and the attackers are just doing different things and we're not actually making anything better? So I was definitely attracted to the vision of cyber public health for that reason. And I have started in the last few months to think about what that looks like. And it led me to pondering this question about measuring cybersecurity through end user harm. So just as the two-slide recap of what cyber public health is for those people who might be joining and are new to this effort, the CDC says that public health is the science of protecting and improving the health of people in their communities. It's concerned with protecting entire populations. And the CyberGreen Cyber Public Health initiative aims to bring insights and inspiration from public health to cybersecurity. And the way I interpret that is that we should create a virtuous cycle in which we are measuring outcomes, just like in public health, one measures outcomes. We analyze the current state of affairs, and we develop interventions that try to improve things. which we can then measure to see whether things have improved. And then we can analyze the result, tweak our intervention, and so on, and keep cycling around and hopefully making things better. And right now, it seems like we struggle. We do not struggle for coming up with interventions. I was definitely on the engineering and education side of that circle. And we do some analysis to help figure out what new interventions ought to be, but we seem to be short on the outcome side. It can be difficult to connect the impact overall on the landscape of are we more secure than we used to be to the interventions that we put out. If the virtuous cycle is working, we ought to be able to measure a decline in successful attacks. We ought to be able to provide sound advice about standards and best practices, thus removing ineffective techniques and elevating effective techniques. So an important question then, if outcomes is the limitation, is what outcomes should we measure? One thing that I was particularly interested in measuring for a long time, being the software security guy, was vulnerabilities. If we are using something like a memory safe language, for example, maybe we can start to drive memory corruption vulnerabilities down and make a demonstrable difference. And projects like Google Project Zero track zero-day exploitation according to what vulnerabilities, what kind of vulnerabilities. And with that information, you could start to imagine if software security efforts were really doing well systemically, maybe the number of vulnerabilities that they observe being exploited might decline. Vulnerabilities themselves are not directly harmful, however. They are a means to an end. They are a mechanism by which we can use computer systems to create harms. They are not the end harm in and of themselves. So while useful to track, it's not entirely getting at that big picture. For example, according to the most recent Verizon data breach report, vulnerabilities were only the beginning of 20% of data breaches that they tracked. The other 80% were credential stuffing, phishing, and other things. So even if we drove vulnerabilities to zero, there is still that other many series of mechanisms that precipitate cyber attacks. So that might lead us to wanting to measure outcomes more directly in terms of harm. This particular paper, this was a 2021 paper that attempts to quantify, to catalog research that looks into harms and in general looks at interventions and computing risk, something that maybe Cyber Public Health would like to contribute to. And it looks at data breaches. This is on the bottom, how frequent they are happening, how frequently they're happening, the scale, whether or not the size of the breach is declining or not. And according to the top chart, it looks at things like stock market price. So if a data breach happens, is it the case that the company that was breached is viewed less favorably in the eyes of the market? And interestingly, in terms of that, this effect on the stock market over time has basically gone down to zero. That back in the 2000s, it would affect your stock market price a little bit. But today, it's just assumed that bad things are going to happen all the time and your stock market price is unaffected. So these things are useful, but they're organization-oriented metrics, right? They're looking at companies that are breached. They're looking at government agencies like OPM that are breached. They're looking at the breach itself, how many records. But what they are not looking at is the humans that are harmed at the other side of these breaches, right? The reason that we steal the records is to do something with them that ultimately is going to create some kind of human harm. So if we really want to go down to brass tacks for understanding what we're doing to improve cybersecurity, we need to understand what human harm is being perpetrated by cybersecurity incidents. So if we are able to track that, we will be able to do a few things. One is we can improve existing measures by extending them downstream. So for example, if we compute that the target data breach leaked 40 million credit card records, extending this harm downstream would be asking, well, what harm happened to the individuals who were whose data was in that 40 million, were they subject to fraud? Were they subject to identity theft? How much did that cost them in terms of time, stress, dollars, negative outcomes, that kind of thing? The other thing we can do is we can maybe more accurately characterize um, what the cost of a breach actually is. For example, if I have a credit freeze on my credit card, from Experian and TransUnion and whatnot, just because my credentials are leaked doesn't mean that immediately someone's going to open a fake account in my name. They may be thwarted by other mechanisms that block them. So being able to estimate harm on humans directly would characterize all of the various interventions we have in place, not just preventing the breaches, but preventing the outcome of the breaches from being negatively exploited. So let's look at a few breaches for fun and think about what the downstream harms were. So I mentioned this Target breach. This was a big one back in 2013. It was carried out over the course of several weeks before the Target folks realized that it was even happening. 40 million credit debit cards were stolen uh, based on use of these malware in point of sale terminals. 70 million customer records with PII were taken. And they did, several people were able to characterize the downstream human effects. So an estimated 21.8 million credit cards ended up getting reissued. You can think of, first of all, the direct cost and pain of having to reissue these cards, but also the inconvenience and maybe real harm that occurred to people who had their cards canceled and needed to, wait 10 days or 2 weeks to get a replacement card. Uh, it was estimated that upwards of $2 billion in fraudulent charges came out of this data breach. So some of that harm is going to go to banks to eat that fraud, but not necessarily all of it. 80 lawsuits were filed against Target, and the CEO ultimately quit the company. So 40 million credit cards sounds bad, but it puts it in context to see what happens as a result afterwards. Another interesting breach where we can consider downstream harms is the Ashley Madison breach in 2015. So Ashley Madison is a site for creating illicit hookups. It's a dating site for married people. You can see, if you look closely on that screenshot there, this is the Wayback Machine screenshot of the web page at around the time the breach happened, and it says they had 37 million, accounts there. In July of 2015, someone publicized that they had breached the site, and they released 2,500 records shortly thereafter to demonstrate that. And then a month or so later, even more information was released. So that sounds bad. Well, what happened? Well, ultimately, Ashley Madison settled 24 lawsuits. So that's at least 24 people that were negatively harmed and had a case to make. Customers were extorted. Some of the data being available allowed attackers to grab email addresses of, say, significant others of the people who were there, and then to threaten the original people that they would tell them. And there were even 2 suicides that were linked to the breach. Another example is the Chegg breach in 2018. So this strikes home for me as a educator. This is a site for students to get help with their homework. In 2018, 40 million customer records were stolen from Chegg based on a data breach. And a little bit later the same year, 25 million plain text passwords were found that came from the breach. So it was posted on the dark web. So what this means is that the customer's accounts, if you had an account at Chegg, your username and your password were visible. And because of the frequency of sharing of passwords between different accounts, your other accounts might have been subject to attack. So this could lead to problems. For example, if your Gmail account used the same password as your Chegg account, someone could log in, guess your email address, log in, and then start using that as a basis for committing financial fraud by resetting passwords and whatnot on your other accounts. So as it turns out, some researchers were able to actually see this as a downstream effect. At the University of Chicago, they looked at they have a password database that covers a 20-year history at the university, and the researchers in consultation or in cooperation with the IT staff were able to look at various events that happened over time, and they were able to correlate the publication of these plain text accounts for Chegg with suspicious activity on University of Chicago accounts that resulted in those accounts getting shut down. So we have sort of a strong bit of evidence here that indeed these people did share passwords and their accounts were shut down at the same time as a result of the credentials being stolen. The last breach I'll mention is the 2017 Equifax breach. So this was kind of the mother of all breaches. 143 million Americans' personal data stolen, extremely sensitive data. Even worse for me, a software security guy, is that this started with an N-day vulnerability. It was not even a 0-day vulnerability. It was something that Equifax had just neglected to patch. And the interesting thing is that there have not been clear outcomes that can be traced back to this breach. And the reason claimed by experts is that the breach may have been carried out by the People's Republic of China to collect data for targeted use, to be able to learn about lots of sensitive information about high-value individuals that they could then spearfish for, say, espionage or other purposes. So this is a case where looking for downstream effects, you may not find them from this particular case. And that while this breach sounds absolutely terrible, maybe it had ended up not being so terrible for most Americans involved in the breach. We just don't know because we're not measuring those human effects maybe as well as we could. So in addition to getting a better handle on the impact of a particular breach, being able to directly query people about harm that they have experienced due to cybersecurity incidents allows us to capture feelings and attitudes, to get a better handle on direct personal hardships, and also to capture direct-to-user crime. So not every bit of cybercrime is a data breach. There can be scams that are perpetrated against individuals. They can end up downloading malware onto their computer, which might include ransomware. And so these sorts of events are not necessarily captured in those headline statistics about data breaches. So in sum, looking at end users to assess harm maybe gives us a more complete picture than just looking at organizational metrics. So as an analogy for how we could have a more complete picture with both organizational and individual metrics, consider the Bureau of Labor Statistics and its surveys to capture the employment market, the employment landscape. They have two main surveys that they use for this. One is called the Current Employment Statistics Survey, which goes out every month to employers, about 121,000 businesses, and they collect things about employees on payroll, hours worked, earnings and wages, and things like this. But the BLS also conducts or leverages the Current Population Survey, which goes out to individuals. And it asks them about things like their employment status and whether they have multiple jobs or whether they might be self-employed. And those last things are particularly important because if you only looked at the employer survey, you would have an incomplete or incorrect picture of the job market. People having multiple jobs would end up getting double counted in that employer survey, and people who are self-employed would not appear at all. And you can see this in the employment rate chart. This is the most recent chart that you can find on the BLS website. And you can notice that the business view from the CES is this lower line, whereas the individual view from the CPS is the upper line. And there is this gap between them where most of the gap is accounted for by self-employment. You can see throughout that the lines don't exactly align. I mean, even it's not just a kind of constant gap in between. They do fluctuate. And so it does give you an opportunity to have a more complete picture and also to corroborate one measure for the other. Okay, so if we're going to assess end user harm, how are we going to do it? So first of all, we need to choose the population that we're interested in. We could, like the CPS, choose a broad sample of say, the United States, all adults in the US, or we could also pick a targeted group, for example, those affected by a data breach. With that population, we want to choose the data to collect so we can assess different kinds of harms, feelings, attitudes, experiences, and so on. And we probably want to get other correlating factors like education, savviness with information technology, age, and various other factors that might impact the harms that we observe. And then finally, we want to choose a collection method. So everything I've kind of implied so far has been about using surveys for this, just like the BLS approach. But you could imagine using automated measurements as well to either augment or replace direct reporting. So let's dive into each of these three categories a little bit. So if we're going to go after a broad population, we might want to use a methodology like the CPS, which is called multi-stage sampling. So what you do is you pick your overall demographic, in this case, maybe the United States. These are all the counties in the US. We want to get some representative sample across them. So the way the CPS works is it, starting from that population, it clusters it according to various demographic information that it feels is relevant for the outcome of the survey it wants to carry out. So it's going to look at things like similar income brackets, similar population in terms of education, culture, you name it. And so they come up with several thousand clusters. And then within those clusters, they select units for actual survey. And what the CPS does is it basically agrees to a panel of participants where they participate multiple times. So they are committed to participate in an interview. The Census Bureau sends somebody out to their house and they actually conduct an interview with them, and they will do it on several occasions over multiple months. And then what they will do is they'll rotate people out of the panel and rotate in new people that match the right demographics. You could also try to get participants by paying them online. Cyber public health, I think part of the goal of the effort is to get government involvement. So, ultimately, if the Census Bureau could do this kind of thing on a regular basis, maybe that would be the best case. But in the meantime, for other studies that you might do, maybe academic studies, you could also try to recruit paid participants online, especially if they fit within a category of people that you're interested in. Another thing you could do in addition to online recruiting is you could try to recruit within an organization, maybe within a large company. If that company is willing to cooperate, they could survey a sample of their employees. Maybe they were just involved in a data breach like University of Pennsylvania just was, and is interested in their employees' experiences, maybe longitudinally, to see what the impact of that data breach might be on their data having been released. You can also, instead of soliciting people to participate, invite them to participate. And this is what the FBI does with its Internet Crime Complaint Center, IC3. This is a site that you can go to, click on that file a complaint button there, and you can submit a complaint, which I'm going to talk about a little bit more later. So one concern with all of these methods is response rate. So if you do this multi-stage sampling, you're going to get the right demographic. That's great. But then what happens if people don't respond to your invitation to participate in the survey? If those people are correlated to a particular kind of person, kind of education, kind of background, then maybe you'll get an insufficient view of the overall population. And it's interesting to me that the CPS, even though this is people showing up in person to do the interview, that they're unsuccessful in accomplishing that interview now only 30% of the time, whereas it was 10% lack of success just 10 years ago. We hear about this a lot with polls for, say, political polling, but I was a little surprised that they're also seeing it here for the CPS. On the flip side, if you're inviting people to send stuff to you, like the FBI is, then of course not everyone is going to tell you what's going on. Just like people don't report every regular crime that is committed against them, people don't report cybercrime either to IC3 based on correlating estimates. The FBI, essentially based on an end user harm survey of the kind I'm talking about in this talk, the FBI estimates that only 10 to 12% of cybercrimes are reported to them. So one idea that I only became aware of on Wednesday is to consider using administrative data as a source of information about end user harm. And administrative databases are those like, you can just think of like a personnel database at a company, except instead of that, think about it as a government agency like a public school system or a housing authority or an employment agency where they have lots of administrative information about people. And it might be that that information contains ripples of what might happen to them in a cybercrime sort of arrangement. For example, like why did you lose your job? Well, maybe you lost your job because your company went out of business because it was hacked, for example. So there's this organization called AISP at UPenn, which facilitates collecting information across multiple administrative databases in order to conduct research studies. And oftentimes they're looking at things like early childhood interventions or public health or education because they have lots of databases of that kind of information. But one thinking outside the box kind of idea might be, are there factors in these databases that correlate with cyber harm? And, is this an opportunity? So it's something that I'm throwing out there in case it sparks an idea in any of you, and it's something that I intend to follow up on. Okay, so once you know who you want to target, you need to figure out what information you want to get. And an important question then is if we care about cybersecurity, we need to know what is a cybersecurity harm as opposed to some other kind of harm. So the broadest definition is harm in cyberspace or harm via cyberspace. It could be that an action in the digital world has a real world outcome, like maybe someone ruins your credit and your mortgage gets canceled. Or it might be that they harm your digital life, like with encrypting all of your files unless you pay ransomware or something like that. So you would need to compute or decide what are the harms that you think are most relevant. I think the most common, we'll see a chart a little bit later, are ones related to fraud. And one of the surveying entities considers all kind of fraudulent activity a kind of identity theft, at least most of the time. So this is where someone misuses an existing account. They get access to your bank account, to your credit card account. Maybe they open a new account. They open a line of credit. They open a mortgage. Maybe they file a fraudulent tax return using your social security number in order to get a refund that was owed to you, but they get the refund instead. So all of these things are in some notion impersonating you in order to get some sort of financial gain usually. Now, in addition to the financial losses that an individual might experience, of course, the other harms include the time spent resolving the problems, the emotional and physical impacts of that harm, the stress that comes from it, the anxiety, and maybe, credit problems, banking problems, debt collectors, employment issues, legal problems. There can be many downstream effects even further from that initial financial loss that you might want to ask about. So one challenge with doing this, just to throw that out there, is that not all credit card fraud is cybersecurity violating credit card fraud. It's possible that, when I stuck my credit card inside of the gas pump, there was a card skimmer there that stole my number, and it wasn't because my number was in a data breach. It might be that someone took a picture of my card from over my shoulder and activated my credit card that way. So we wouldn't be able to tell the difference between those things. It would be nice if there was some mechanism that would help you distinguish them, but it's still probably worth tracking. While I was preparing this talk, I found a couple of PhD theses that that aim to define frameworks for characterizing cybersecurity harm. And these would be good places to start in figuring out what questions to ask. Okay, so lastly, we know our population, we have some idea of the data we want to collect. Well, how will we collect it? The most obvious way is surveys and interviews, as I've been talking about, just like the CPS. But you could imagine passive monitors also. So, for example, the Nielsen rating system, which has been around since, the 1950s, back in the day, people who are Nielsen families would fill out a card every night describing what their TV watching habits were, and then they would mail it into the Nielsen company, which would then tell people, submit reports to content providers about who's watching their stuff. But today, what Nielsen does is it uses installed sensors. So people who participate in Nielsen ratings install an app on their phone and it monitors their activity. So it knows that they're watching Netflix or Hulu or whatever. You could imagine doing the same thing with cybersecurity. If people are willing to have passive monitors installed on their networks or on their computers, just like they are with Nielsen, then you can get some information. So these are two papers that previously did use a kind of monitoring approach. The paper on the left was by people then at that time at Semantic Research Labs, where Semantic's uh, antivirus software is running on lots and lots of PCs, and it's sending information back to the mothership that these researchers had access to. So they are able to, for example, go back in time to find out when zero-day vulnerabilities were first being exploited prior to when there was an antivirus signature that could detect that exploitation. Having extensive monitoring of this flavor might give you some direct knowledge of when someone has been hacked and what kind of harms they're experiencing. The paper on the right is looking at more network level, but also PC level behavioral monitoring as well. Okay, so as I was putting together this talk, when I started it and I talked to a few people, most people I talked to were not aware of much surveying of end users to find out what harms they experienced. But as I prepared the talk, I found that sure enough, there have been surveys of that variety, and that maybe a thing for the cyber public health effort to do is to try to ramp up the frequency and quality of these surveys. So these are vehicles that are good starting points and opportunities for us. So the first one is the American Trends Panel, which is managed by Pew Research. It is a panel made up of roughly 10,000 adults who are selected at random. The selection process is similar to that multi-stage sampling idea that I mentioned before. It is a panel, just like with the Census Bureau's CPS, and people rotate in and rotate out. They use a survey vendor, SSRS, to help manage the population. So in 2023, Pew leveraged this panel to carry out a survey about data privacy. So of the 10,000 people on the panel, 5,100 participated in that survey in May 2023. So here are some of the things that came out of the survey that were interesting. So the first is that here in 2023, they computed that 26% of US adults had fraudulent charges put on their credit or debit card. So that's maybe not that surprising, but I feel like it's a little bit surprising that there is that much fraud, that 1 in 4 people experienced some kind of fraud that way. They observed that they previously carried out a similar survey in 2021, and the level of fraud was only 21%, not 26%. Another thing they asked about on the survey, they asked about lots of things, I just cherry picked two things, was how comfortable people felt they were in responding to an attack. And while a majority of people felt very or somewhat comfortable, it wasn't a big majority. A lot of people felt uncomfortable about it, which says something about people's confidence in using IT systems. So that's a great source of information, and maybe Pew would be a good partner for a regular survey. Another source of information is the National Crime Victimization Survey. So just like the CES and CPS, We have agencies that track crime statistics. So this one is the Bureau of Justice Statistics. The FBI also tracks crime statistics. It surveys police departments. But in this case, the National Crime Victimization Survey is a survey of individual households. So the normal NCVS happens every year, and it's mostly about physical crime. It's about, assault, rape, theft, vandalism, that kind of thing. However, every few years, you can see there 2008, 2012, 14, 16, 18, and 21, they have also carried out what they call the identity theft supplement. So this is people who take the regular NCVS are then invited to also participate in the ITS. And this asks about identity theft of the style that I was talking about before, fraudulent account use, for example. So in 2021, according to this survey, 9% of the people surveyed experienced some kind of identity theft, credit card fraud or whatever. So this is very interesting to me because, I guess this is a larger population, right? This was 240,000 people as opposed to 5,000 people from the Pew survey. But for the same question, basically, have you had experienced fraud of any kind? Here, they're finding 9%, whereas Pew in the same year was finding 21%. So this shows you kind of a difference in the breadth of your population sample potentially being pretty important in the results that you get. Another interesting thing that came out of this survey was they asked people whether they had been involved in a data breach or not. And if they had, it turned out they were more likely to have experienced cybercrime. It's actually, I take it back, it's actually the other way around. If you experienced some kind of identity theft, you were twice as likely to have been informed that your data was in a data breach than if you didn't experience any sort of identity theft. So it shows a connection between the data breach incident and the actual cybercrime. So I thought that was interesting. And then the last thing I'll talk about, and then I'll be finished, is the Internet Crime Complaint Center data, which I mentioned before. If you click that button on the right, you get this 7-part survey on the left, where you provide your name, address, what your complaint is, what evidence you have for the complaint, and so on. And both businesses and individuals are encouraged to fill this out. It leads to some potential for double counting as a result of that. So the most recent FBI Internet Crime Report is drawn from the IC3 complaint database. And you can see on the left y-axis, the blue is the number of complaints. So those have been going up. And on the right, the y-axis is the dollar estimates in losses. And you can see that's also going up. This chart is interesting in breaking down the kinds of fraud that were parts of those complaints. You can see the big thing that I took away is 83% of the losses that are being reported are fraud related. Like this is the main outcome of cyber incidents that people are reporting. So I'm at the end. Cyber public health is especially interested in measuring outcomes in order to complete this virtuous circle. And in this talk, I have argued that measuring humans harmed is a good way of doing that. It complements other measures that you might care about to give you a more complete picture. It augments and extends those measures by capturing feelings and exposing personal hardships, and also considering direct-to-user crime. So I wrote down a few possible discussion questions to get your take on what I have presented in terms of what data sources maybe I didn't cover that you know about that we should go after, what collaboration opportunities there might be for a lowly university professor like myself and organizations that you all might represent, and any other ideas you have about populations, harms, or sensors that we might try to bring to bear.
Thank you so much. Thank you so much, Michael. This is so great. I really love that, from the public health lens, it's always the patient's outcome data plus this geographics data, demographics data, population data gives us so much to tell us. And we're wondering how we can build that in cybersecurity. And there's a lot of ideas in here. I would like to, open the questions or comments from the audience. But maybe I would like to pose one, if I can. I have so many questions. Um, one thing is, how are you treating a psychological harm, or more, a mental harm? When I when I hear about you talking about this dating site, the secret affairs, there's two suicides. There are two kinds of harms, which is one is recoverable. I mean, you lost your credit card, you can recover that. Lives and the trauma, those things, I mean, life is definitely unrecoverable. Now, those are something that's very important to, risks that we should differentiate and measure is one thing. And then how you are taking that to your metrics is one question. The other thing I wanted to contribute was in a cyber public health workshop, we discussed about how to measure the harm. And we brought this idea of digital activities of daily living, ADL. So there is, in a public health arena, activities of daily living is the 10 main activities in your physical life. And then you measure your functionality of your body by checking, can you wake up? Can you eat yourself? Can you take a bath yourself? And then understanding your functionality. And then there was some interesting ideas at the workshop that we should develop this digital activities of daily living. And then it's probably different from a different groups and cohort and professions. But to build that, you sort of clearly understand what's the harm is. If those activities cannot be, do it, that's all harm. And then that's the, one way to measure it. So I wanted to contribute that to you. There's a workshop report including that. So I'm going to send it to that.
Thank
But
you.
with that, I wanted to your response. And then I also wanted to open that group for more.
Sure. Thank you for the questions. So I think in terms of characterizing harm, maybe this is why it's so easy or natural for people to use dollars as it's a number. You can add dollars together to say that it's more. It's records. I can count how many records are released. And that helps give you some sense of magnitude. But of course, these other harms are also real, but they are not so quantifiable. My feeling is that probably a good approach would be to use ideas from qualitative research methods where people do interviews, semi-structured interviews, and then they are able to analyze the text of the interview and response afterwards to characterize common trends and to also characterize strength of that response in context with everything else. So there are tools for doing qualitative coding, iterative open coding of interviews. That would be the first thing I would try. That's what those two theses that I pointed to are doing to figure out a kind of a taxonomy of harms and then figuring out ways to, measure those harms in a more qualitative sense. And then your second question about the activities of daily living, I mean, that sounds great. I definitely want to see that report. And I think that second paper that I showed, not the semantic paper, but the other one, was effectively trying to do that. They had passive monitors on something like 10,000 computers on this, I believe it was on a university network, I might be mistaken, and they did, observe activities of daily living and observe when those activities were compromised. So that would be a place to look for some inspiration.
Thank you.
I
Uh,
saw Blake had his hand raised, or
yeah.
her.
Okay, Blake.
This is fantastic. I truly appreciate this is a fantastic summary of the like landscape of the public health. So the main question that I kind of wanted to go back to was your root definitions. You're presenting a ton of papers, so I'm going to have to come back and read through a lot of the this literature that you've reviewed. But going back to the core root of that public health circle that at the beginning of your presentation, so like how are you building that definition?
This definition,
Yeah, yeah.
that was just me. I mean, I don't know. Adam gave a guest lecture for my class, and in introducing it, I kind of arrived at this picture. Um, yeah, I mean, I guess it's up for debate what cyber public health is about. But the thing that I always took away as being the biggest value from it was this being able to connect choices that you make in public health, like, more sanitation, more vaccination, more um, information to inform people, whatever it might be. And then to be able to tell, well, did it work? Can I connect the intervention to the outcome? And so outcomes are really important, but outcomes feel more scarce. We don't have an agency that's specifically about cybercrime, for example. We have maybe a few agencies, Bureau of Justice Statistics, the FBI, but they maybe have an incomplete picture. So, what can we do to track outcomes that matter for this question, cybersecurity?
Yeah, because I truly appreciate the that focus down on the human harm. I think that that's a really positive way of approaching this. Especially it just really clears out a lot of like the possible and like drives it down towards that human harm. The interesting thing that's kind of it may be dropped, it may not be dropped, is thinking about that organizational. It's when organizational failure causes human harm, and it's like through an indirect pathway. As an example, healthcare agencies experiencing ransomware events, it's there is obviously human harm, but it like in this, at least in your presentation, you're primarily focusing on like financial loss or direct impact where a a criminal or bad actor is taking action directly against the individual, as opposed to this weird nebulous systematic loss where you lose this critical infrastructure, the hospital's ransomware, and then you experience this impact to your patient care, which is kind of a tenuous relationship and really hard to measure. But I truly appreciate this development of that definition. So thank you.
Sure, yeah, and that's a great point. I think I was poo-pooing the measuring of vulnerabilities exploited at the beginning a little bit, but I'm not actually poo-pooing it. Like, I think we do have to measure things all along the chain in attempting to connect the dots. If you just had the harm and you paid no attention to all the steps for how you got there, you wouldn't be able to do that analysis that I have on this slide to say that the intervention actually made any difference, right? So you do have to connect the dots going back, and looking at things organizationally is also, of course, important.
Just one small point to add to this conversation. Like in the public health field, I kind of have this common definition of the science and the art of preventing disease, prolonging life, and promoting human health through organized efforts and informed choices of society, organizations, public and private communities and individuals. And so like that kind of encompasses the entirety of the public health space, despite that it's not just the actions of one group, it's kind of like this giant approach. And like how do we develop that definition into the space of cyber public health is really interesting. So thank you.
Yep, thank you.
Anybody else? wants to add here. One of the definitions of the cyber public health that is we use is we look at the population level, societal level, rather than it's, versus like medicine versus public health. It's the corporate and individual versus population level. We identify the risks that comes to population level, and we need a collective actions to reduce those things. And again, how to measure that outcome is a challenge point. And Ron, please.
Yeah, I was just curious thinking about this question of like, right, we have different types of ways that we get to the same outcome to some extent, right? If we have what happened with Change Healthcare ransomware event that led to hospitals closing and then downstream effects on patient safety. But then we also have stuff like the CrowdStrike incident, which is not technically a malicious event, but like we still lead to potentially similar outcomes occurring because businesses have to close, leading to harm. I guess just like in thinking about what you were just saying before of the different measurement points along the chain, like do you have any thoughts of how you kind of uh change the perspective of malicious attack versus non-malicious incident in sort of these outcomes?
Yeah, that's a great point. So I guess the way I'm thinking about it is, yeah, that probably what needs to happen is you need to roll forward from events that you believe are security events that should have been stopped, and find out what were all the precipitating moments, outcomes that led to exactly the things that you just described. You start from the event and you roll forward to hypothesize or even directly measure things that you see. Once you've rolled forward, you now have a vocabulary for things that you want to pay attention to, kind of in general. And now I can potentially map those things back as well to create context. Because I think that's the place where security has really struggled, right? We're good at the rolling forward part. Hey, I have a buffer overflow vulnerability in my code. I can exploit it. I can then do a remote code execution attack. I can then take over this server. That's bad, stop, and then I'm finished. And then what that doesn't allow you to do is say, well, how important is that? How, if I put it in context that I have $1 and I should put the dollar into finding all those kinds of vulnerabilities or doing more education or whatever, like I can't answer that question because I don't have the context. So to me, the trick is to figure out the roll forward, what are all the bad downstream things, and then track that stuff, both things that have been derived from the negative event, but also just contextually, what is the baseline? And then that gives you a way of creating that context for prioritization.
Out of curiosity, would you view that as something like an attack type framework, like from MITRE, but with the sort of larger consequences, I guess? Is that kind of the
Yeah,
definitions? Yeah, I
yeah,
guess.
totally.
Yeah.
That's
Okay.
a great observation, right?
Okay.
Instead of just stopping to the point of compromise. So that paper I flashed up there, that SOK on
Yeah.
quantifying cyber risk, they have a little, causal model inside of the paper. And what they point out is that you can start from threat and make it all the way to harm. But lots of people, there's something that usually happens in between, which is this moment of compromise. And papers often stop at compromise. They'll just go, oh, yep, I took over the server. That's the end of it. But you could definitely imagine continuing on. You could just say, hey, from a compromise, I don't care how it happened, what are all the downstream effects? And, follow that same playbook.
Well, and then also there is a big harm, like romance, attack against elderly people, who's probably a very hidden and unreported harm that people probably not going to discuss or report, or, but it's very, very bad. Economically, it's huge. And then how we're going to categorize those and measure it is also something that we should address. Audrey. And then I'm going to close it after your last question.
Yeah. Thank you. I've learned quite a lot. I knew about IC3. I didn't know about the rest. Mind you, the US is not my territory in bracket. I'm from the UK. There were two things that came to mind. First is it worth studying how other countries look at their methodology for accounting for harm, for cyber harm? I'm thinking here in the UK, you've got the British Crime Survey, so it's about, interviewing effectively victims. It's a sample, it's random. It's quite complex methodologically, and as a lawyer, I don't understand all the complexity, but it might be useful. And there's also one report that just been published in early 25 by a Home Office, the experience of victims of cyber fraud. That was quite enlightening in terms of some of them didn't feel that the harm in bracket they suffered was worth their time reporting to the police. Which, when you look at it, some of them it was like, well, maybe I've lost £50 and it's not worth my time because I'm going to spend 3 hours and it's worth more than, The other thing that I was thinking of is, and it was linked with your answer to the last question, is when you explained that chain and that notion of compromise, I was thinking, do the criminologists do the other side? But never what we're doing, and is it worth starting thinking about joining the two in trying to get that full picture? Really, I have no clue. I never thought of this, and you don't have to answer.
I mean, I had the same thought when I was preparing this, that once I landed on the Bureau of Justice Statistics website, I thought, oh, this is the domain of criminologists doing statistics. So yeah, what do they think about cybercrime? Like, I've never talked to a criminologist that knows anything about cybercrime. That maybe they are the right people to talk to. That sounds like a great idea.
Well, thank you so much for the great conversation and discussions. There's a lot of ideas comes and then a lot of collaboration, hopefully, coming out. This is really important metrics and measurement. So thank you very much again, Michael, to coming and then share your research and study. Hope to
Thank you.
continue this.
My pleasure.
Thank you all. Have a great holiday season. And I will see you next workshop. Thank
Okay.
you.
Thanks
Bye-bye.
very much, Michael.